Hi everybody, this is John and Maria's video on renal and liver biopsies, and so here we have everything set up, all the basic supplies that you usually need for a liver and renal biopsy. We have our sterile field set up here already. We have a couple of sterile drapes laid out, and then more of the basic supplies here. You have some sterile OR towels that you'll need. You have the needle block or needle counter. You have a ChloraPrep pad for disinfecting, some needles, a scalpel. We also have a couple of syringes, the sterile probe cover kit, and of course you have some lidocaine here to numb the local area in which the biopsy will occur, and then the biopsy gun itself. So usually when this procedure takes place, the patient will come into the procedure room. We have our sonographer here, Maria. So the patient will come in. They usually have a seat on the table. We verify their identity, and then from there the procedure is explained, all the risks and benefits. The doctor comes in as well. Usually if there's a mass in question, we'll pull up a previous study and it goes up on the monitor right there for reference. And then from that point on, there's usually some preliminary shots that are taken of the area of interest. So here we have some preliminary pictures of a liver biopsy that was done actually earlier today. And after that, then you continue setting up your sterile field. You unwrap everything. Needles, syringes, and everything are placed on the field there. Okay, so we have our sterile field set up. Our patient is ready. She's just going to expose her abdomen. And then we've taken our preliminary pictures and we're going to go ahead and prep the area. So I have my sterile towels here that I'm going to open up. It should only be handled with sterile gloves. The other shirt too, man.
Oh.
Can't scan through your shirt. Okay, thank you. Please don't move. Sometimes patients want to move a lot during this procedure, so it's important to explain to them that they're not allowed to move, especially when there's a sterile field being set up. There we go. Lots of towels. Another thing that's really important for this is making sure that they're comfortable before you set up the sterile field. You see that the patient's arm is at her side. If she feels more comfortable with the arm above her head, it's important to let that happen before you set up the sterile field. But there we go. So we have our sterile field set up. The next thing we would do is prepare the area with the ChloraPrep kit, and then of course put your sterile probe cover on. The probe would be sterile. The doctor would usually be operating that while locating the area of interest again, and then the next thing they would do is use the lidocaine to topically numb the area. And then they would introduce the biopsy needle to the area. There's two different ways to do it. There's freehand, and then there's the use of the needle guide. Here at our facility, they usually just do freehand with the transducer. And then they would go into the area, do a couple of passes with the needle in order to obtain an adequate sample. Usually takes about 2 to 4 passes. It looks like here there was 3 done. And then afterwards you do a post to make sure everything is still okay afterwards. And that's it.